Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging, and we want to help you be more successful. And our guest today is Josh Otten. He's Director of IT Solutions Engineering and Design and Architecture at Adventist Healthcare. Welcome, Josh.
Hey, John. Thanks for having me.
Yeah, excited for this discussion. I love having people on that are doing the hard work. So I, I think that would probably describe you. So, but before we dive into the topics today, tell us a little bit about yourself and Adventist Healthcare.
Yeah, sounds good. I've been with Adventist Healthcare for about 7 years now. I came from Adventist from 5 years working in the federal healthcare space. As you mentioned, I serve as the IT director of our solutions engineering, design, and architecture firm. Supported a number of business, clinical, and IT specific strategic efforts and implementations over the year. And as far as Adventist Healthcare, we're a regional healthcare faith-based nonprofit based out of Gaithersburg, Maryland. We're provider-based healthcare. We serve Montgomery County, Prince George's County in Maryland, as well as Washington, D.C. We're a managing partner for Howard University Hospital. Number of acute care facilities, rehab spaces, outpatient imaging, and a lot of different those provider-based services.
Yeah. Excellent. So let's talk about it. Like, what are some of the biggest IT infrastructure challenges your organization's faced recently?
Yeah, so Maryland's an interesting state when it comes to healthcare. We're in a capitated model for healthcare. So for all intents and purposes, we're fixed revenue for all our hospital-based services. So they're really the only way that the best way that we can influence our bottom line is by keeping costs down. So that is challenging in healthcare IT and IT in general. I mean, it's an expensive industry. So we have to find the right solutions, the best solutions, and they always have to be the most economical for us. We have to make sure those solutions address our problems and serve our needs, and we can't afford to get it wrong. So we can't have those false starts and those sunk costs. And because of that, we run a very lean team for supporting our infrastructure. So we do have a lot of challenges there, and we're prepared, and that's all we know, right? So that we're best prepared to do that, but it definitely presents challenges that are unique to healthcare in this country, in the state of Maryland.
Yeah, that's really interesting. And I mean, obviously, we become more reliant on this infrastructure in healthcare with the rollout of EHRs. And I mean, I think the average number of systems is 1,000 systems in a health system. So, obviously, we become so reliant across the entire organization. How are you, approaching and addressing these challenges, especially given the fact that, that's the way you have to do it, is addressing costs, right? Like, if you ask any business, is it easier to address costs or grow revenue? They say grow revenue. Like, wait, that's not an option for you. So yeah, talk to us. How are you approaching addressing these IT infrastructure challenges?
We have to be strategic. We have to take our time. We can't be reactive. So we truly need to understand what we're trying to serve, what a problem that we're trying to solve, and we need to forecast some of our future needs, the total cost of ownership, including the resources for operations and maintenance. That's big. That's really, really huge. Just in the storage space, that's led us to some partners like Pure Storage that we've worked with. The being able, we did bake-offs, we did a lot of industry analysis, and found a lot of different, found that, in the case of like Pure, right, we found models that can effectively help us upgrade in place, give us, latest controller technology for our storage devices, in our support renewals, and also have the tools to be able to kind of model and project a lot of the performance when doing upgrades, like controller upgrades, adding drives, adding shelves, things like that. So any type of partner, any type of solution that allows us to be able to give us the most data points to be able to effectively strategically make those decisions are generally is where we're going to lean.
Yeah, I mean, I think people underestimate the impact that something like storage, right, which is what Pure Storage does, impacts. I've done some work with Pure Storage before, and we talked about how, well, if you implement the right storage, you actually can improve provider productivity and reduce burnout because it goes faster, right?
Yeah,
Like,
absolutely. Yeah.
it sounds like that's what you experienced as well.
Yeah, it definitely. We definitely saw an increase, probably I would say roughly 15-20% increase in speed. But the biggest thing is reliability, right? So,
Okay. Yeah,
in
that's
the,
even worse, right? You
yeah,
open the EHR, it doesn't open.
yeah, well, the PACS environment, in
Oh,
imaging,
yeah.
right? So and that's one of our major use cases
Gotcha.
with our flash blades that we have from Pure. We had a lot of issues with reliability of our previous solutions, and just the workflow of imaging. When you come in for an imaging exam, or they want to pull up relevant priors and have those for the radiologist to read and compare based off of the image that's being captured that day. And those images get prefetched, and they get put on those flash blades for the radiologist to pull up and compare. And in some cases, previously, that was not reliable. We didn't have the ability to do that. Our hospitals are brain and or excuse me, heart and stroke centers. So we get a lot of emergent cases. Really important to be able to diagnose and treat those within that golden hour of a patient coming in. So that reliability is huge for us, and it's been something that has been definitely a benefit that we've seen with working with solutions like and partners like Pure.
Yeah. Well, as someone who just sat in an ER waiting for a CT scan, I appreciate that on a different level, I
Yeah,
think, when it becomes personal. Talk to
yeah.
us about some of the other benefits you got from the change. How about, staffing? I mean, it's interesting. You talked to your lean team. I think that's interesting, or security costs, etc.
Yeah, so right, decreased management overhead is really been huge. That's freed up our staff to work on other things, specifically things like modernization projects. Like anytime we
Okay.
can take staff away from fighting fires and being reactive and responsive to incidents, we can then take those resources and allocate them to modernizing and working on project activities and things like that. We keep our staff very, very busy for sure.
Yeah.
Um, we've definitely seen a benefit we operate out of co-located data center, which is a pay by rack space model.
Okay.
So going from like full racks of storage shelves to a handful of use has helped us and save some costs, save some space for us in our data center. And security is huge. Security is obviously a really important tenant right now in healthcare IT. Being able to leverage the immutable storage for
Mhm.
backups helps protect us and gives us an extra layer of protection against ransomware. Because the first thing a bad guy's going to do when they get into your environment is they're going to try to delete your backups so you cannot recover from what they're doing. And having immutable storage, having a lot of the fail safes there is really, really beneficial to us.
Yeah. No, I think you're right. Like when I look at the front line of security, storage is like with the backups associated, which are now or you can do in real time. You can, I mean, there's so many options. Either, I come from the tape days, right? I think many of us do, right?
Yeah.
You're like, yeah, I'm not even sure that tape works, right?
Right, exactly. Yeah.
But now they've come so far, right? And having, like you
Yeah.
said, that business continuity in case of ransomware, and as they say, when a ransomware incident happens,
Yeah.
it's such a powerful approach. It's interesting how storage often doesn't get the credit it deserves when it comes to security. So that's great.
Yeah, for sure.
For your packs, like, was there any thought of moving to the public cloud, or did you not even consider it because of the size and and you already had the data center, et cetera?
Yeah, I mean, we like I said, we're going to make strategic decisions. So we're going to do our due diligence,
Mhm.
and we did our due diligence, and we really we definitely weighed a public cloud solution. We generally we talked about the kind of the capitated model at Maryland. We generally are dissuaded from migrating any of our real critical infrastructure to the cloud for a couple of reasons. One, the capitated model, variable costs, which oftentimes the public cloud are tied to, they don't agree with that capitated revenue model, right? We have to have predictable costs.
Mhm.
So that's one. And then the introduction of additional failure points into the design. In this case, your ISP now becomes a potential failure point. We're on a private dark fiber network that ties into our co-located data center. So we have control over our WAN. And, once you start piping those things out over the ISP, not to say that there's not reliable ISPs out there, but, there might be, for redundancy purposes, we might have to take on an additional connection and those types of things. So that became a little bit of a point that kind of dissuaded us from moving that direction. And so that's what kind of really led us to the decision of maintaining that on-prem storage.
That's awesome. No, I mean, I think it is interesting. You talk about the public cloud, the variable cost is something that I think is going to be interesting to watch going forward. And the ISP and then the need for extra bandwidth, I think, that's another variable cost as you use it more that, a lot of people forget about because we almost just take it for granted that it's going to work. So that's interesting.
Absolutely. Yep.
Have there been any other downstream impacts to the end users thanks to the improvement of the backend storage? You talked about, more responsive time. Anything else that was notable in the project?
It's funny. It's actually kind of funny. We've experienced some unintended consequences of having more reliable systems, and now we need to work with their clinicians to drill on downtime procedures because they don't have a chance to exercise them as frequently.
I guess that's a good thing.
Yeah, it's a good problem to have, right? So now when we do have a true downtime, a lot of times we're having to teach people on the fly. This is your downtime procedure. This is how you go to paper. These are the things you do. So we've gone to some drilling of those downtime procedures. It's a good, like you said, good problem to have, and it's a consequence of reliability. Other than that, I mean, speed, the front end observable read write speed for users. A lot of times you don't get the kudos necessarily.
Yeah.
You're not getting a ticket that says, "Hey, by the way, I just sent a case in and it was so fast, and I just want to give you guys you get the ticket or the call or the email that says, it took me 20 minutes to load this image in, or I've been spinning on trying to get my files. So we've seen a real reduction in that.
Interesting. Yeah, I mean, it's like security. No one says, thanks, we haven't had a breach, right? You only get the complaints. Speed is the same thing. That's really interesting.
Exactly.
Great example.
Yeah.
What other technologies or challenges are you keeping an eye on that you think would be important to your organization, beyond just the storage that we talked about?
Well, obviously, artificial intelligence is a very buzzy word right now. We could
You think it's going to hit infrastructure? I mean, I guess it's hitting everything.
Or infrastructure? Yeah, sure. We've seen it. It depends on what you're going to classify infrastructure, but our security operations centers, we've talked about them and implementing some. They're implementing some chat GPT functions that give executive summaries of incidents and things like that. So in the EMR space, we've certainly seen some technologies of pulling out relevant notes and data to present to the clinician in advance of seeing a patient. But from an infrastructure perspective, some of the things that get me kind of excited and are really cool things are like patient room technology. Very cool stuff. The ability to have the ability to directly influence patient care. And obviously, that is not necessarily traditional IT infrastructure, but having things like cameras in rooms that have the ability to do like virtual sitting functionality, enablement of virtualized centralized nursing models, virtual care coordination with remote primary care providers and caregivers. and some things like that. Digital whiteboards in the room that utilize
Mm.
RTLS technology. Very
Yeah.
cool stuff. You know, you can have a badge on your nurse provider, or when they come in the room, you know, a picture of them and their background shows up on the digital whiteboard for the patient to know who their care provider is. Cameras that enable patient metadata, capture of patient metadata. You know, how often are you turning in your bed? How often are you getting out of bed to avoid things like pressure ulcers?
Yeah.
How well did you sleep, toss and turn in the night? Those are things that are important to clinicians and to physician providers. Touchless biometric devices that use radar to measure heart rate, pulse oxidation, other important you know, biometric measurements, and other biomarker devices. Those are a lot of things that we're talking about right now, and that's some of the cool stuff that I get to do research on, and I get a chance to play with, you know, do that due diligence, put together some of those models to present to our leadership and to some of our clinical staff.
Yeah. No, it's exciting times. You know, with such a nimble team, are you concerned? Like, because that's a lot of stuff,
It
right?
is, yeah.
To implement, and and related to that, you know, is this going to be a best of breed approach, or are the big vendors going to do it? Any thoughts on kind of how you'll approach that, especially with a nimble team?
Yeah, it's so we have to rely on, you know, in IT, we have to rely on some of our sometimes we call shadow IT teams, things like
Yeah.
staff like clinical informatics,
Uh-huh.
and folks that are that are a little bit more clinical, and
Sure.
they have kind of a tangential connection to IT.
Mhm.
So it's every type of system that we implement, we have to in that due diligence phase, we have to understand how it's going to be supported. Because to your point, we can't take on these things without going up to our CFO and say, "Hey, we need dedicated support to be able to." We're doing that just in AV right now, just talking through conference rooms. The
Wow,
AV
that's interesting.
is,
Well,
you
but
know,
every vendor will say it's easy, right? It's
of
turnkey.
course,
No
yeah.
support needed.
And you know, your desk side support team, your help desk can do this, your EAs can do this, but that's not when you put it into practice, that's not what we find. So
Yeah.
we have to be realistic in that, and we have to understand those support models. We need to understand the workflows that need to be supported, and assign responsibility to, you know, do those racy matrices and things like that of
Sure.
the systems. So yeah, it's a
Yeah.
lot.
Not to mention, the security risk surface, et cetera, right? I mean, that you're still responsible for that, even if it is a fully outsourced type of implementation. So
Sure, absolutely.
interesting. Well, we always like to wrap up these episodes with a little bit of career discussion and career advice. So, I just want to ask you, what's the best piece of career advice that you've ever been given?
Interesting. That's a great question. Um, I had a mentor one time with my federal days
Hmm.
that said to me that, you know, success in your career can be boiled down to two main factors:
Hmm.
capability and commitment. And, you know, capability is what do you know and what can you do, right? And that's pretty straightforward. But commitment is how willing are you to take ownership for your charge and continue to take on responsibility, accountability? How reliable are you? How much do you care about what you do?
Wow.
And you need a combination of both. But to me, and this is the conversations we had a lot of conversations about this. To me, commitment can take you a lot further, much further than just capability alone. For me, I've kind of taken that to heart. I got that advice pretty early in my career, and I've
Mhm.
built my career on being committed, being accountable, being trustworthy, being accessible, and being someone that can be counted on. And then capability kind of comes along the way, and it's been supplemented with education and just experience and everything like that. So I like to I love that you asked that question, because anytime I'm in a mentoring role myself, I always bring that up, and I hope it really sinks in with the people I'm talking to, because commitment is a huge thing, and being that person that someone can rely on can really take you pretty far in your career.
Yeah, that's powerful. I love it. And I guess I have to say, I appreciate you sharing your capabilities and your commitment to this work. I learned a lot in this discussion, so appreciate you sharing that with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast application. Thanks, Josh.
Thanks, John.